Yeah, just ask Dr. Ben. Oh yeah, that bird's going nuts. Let's see. Next question is from Vicky from Niles. Hello, Vicky from Niles. It's been a while since I was in Niles. Yeah, I don't know. We'll get back up there as soon as this is reasonably contained, I think. So let's see. I saw virologist Dr. Joseph Fair on TV. Okay, I don't know who that is, but all right. And he believes he contracted COVID on a packed airplane through his eyes since he had a mask, gloves, and wiped down his seat area. Do you think that we should all be wearing goggles of some type? Yeah. I mean, people are chafing, to say the least, under the idea of masks. I think if you throw goggles on top of that, I don't know. Yeah, compliance will probably go down further. But let's talk about the actual science. So I had the privilege to talk to some Chinese doctors today. Um, and During that, I was asking about what do we know? Because over the past week, we've had a couple of papers come out that say that the eyes could be a site for infection. So they have the right receptors and they're turned on, and yeah, it's like, why wouldn't the eyes be infected is kind of the case. And the way that would probably appear would be that it's the conjunctiva of the eye. So this, white part, I won't just jab my finger in my eye, but yeah, you get it. And the sort of membrane on the surface of the eye. This is what can get infected. And so question is, can you get viral conjunctivitis with SARS-CoV-2? And so I asked this to the Chinese doctors, and they said, "Oh yeah, we've seen this." In fact, this doctor noticed two patients who started out with what appeared to be a viral conjunctivitis, and then very shortly thereafter, they were positive for the SARS coronavirus 2 by a throat swab or nasal swab, whatever they were doing at the time. And so it moved, they think, from the eye down into the lungs, which is, there is a pathway. I mean, the tears are going to take this pathway when they go back into your throat, but once they get into your throat, yeah, sure. The throat is directly connected to the lungs, and so there's nothing really that would keep the virus out. There are enzymes in tears that would be good at breaking down the virus, but nothing is 100% efficient. Like even in Pokemon, your move may be super effective, but it's not always going to be a one-shot knockout. It's a matter of did enough of these viruses get out, and it looks like maybe they have. So but the fact that I'm talking to people from Wuhan, China, and they've only seen two of these in the entire course of the outbreak suggests to me at least that this is a pretty rare occurrence. It's like a thing that could happen but won't usually happen. And figure that pretty much everybody else other than those two over there, so the 80,000 some people, probably got infected via the mouth is probably most likely, nose might be second most likely. And so I think that's, if you're prioritizing these things, I would say step 1, cover the mouth. Step 2, cover the nose, and a mask does a great job of both of those. Step 3, if you have the ability and want to do it, something like goggles is a good idea. And then this plus don't engage in dangerous behavior. And weirdly, dangerous behavior is what we would have called like normal social behavior in the time before the COVID. Somebody says hi, that's fine, you say hi, but you're a step or two back and you've got a mask on. And in a situation like that, it at least lowers your risk. There's no way to make all the risks go away completely. It's about finding something that is at least mostly effective and or effective enough. Yeah, I think that's sort of the idea behind all of this personal protective equipment and all the ways that we protect ourselves. So yeah, that's a great question. Thank you very much. This is Ask Dr. Ben.